As COVID-19 vaccinations continue, it is important to understand what to do after you get your vaccine. In today's To Your Wellbeing, we are breaking down what you need to do hours, days, even weeks after your vaccination. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us now. All right, let's start with the very first few hours after getting the vaccine. What possible side effects after that first and second shots, and then what steps can you take if you experience those issues?
Sure. Well, first of all, Tanya, thanks for having me. And I would break this down into the first couple of hours. The first 15 to 30 minutes after your vaccine, you will be monitored wherever you get the vaccine, whether it's with Cone Health or any of the other vaccine providers. And the reason that we do that is to make sure that there's no immediate reaction to the vaccine itself. Once people are past that first 15 to 30 minutes, most people are not going to feel anything initially. So in the first few hours, really very few, if any, symptoms, other than you'll feel like you got stuck in the arm with a needle, because you have. But really shouldn't anticipate very many reactions within the first 2 to 4 hours.
All right, so this is a very common question that we get. Can you take ibuprofen either before or after your shot to kind of mitigate those feelings?
Yeah, good question. And if you normally are able to take ibuprofen, the answer is yes. I wouldn't necessarily recommend it, just because avoiding medications in general is a good idea. And if you were going to start with something, maybe acetaminophen, Tylenol is a brand name of that, before ibuprofen, any of those things are safe as long as you normally can take them.
Right. Are the side effects different for the Johnson & Johnson vaccine versus the Pfizer and the Moderna?
In general, no. People who, the data with the Johnson & Johnson vaccines from their study is pretty typical of most vaccines, potentially a sore arm, maybe some minor flu-like symptoms after the immunization. There would be a lot of similarities.
Okay. And then, so often you do say that people are going to watch people after they get their vaccination to make sure that they don't have any kind of reaction. But what signs maybe should you look for later on that could mean maybe you're having a reaction that does need attention? And then what should you do if you notice those?
Most people who get the vaccine, again, are going to really feel fine. They, again, might have a little sore arm later on after the vaccine, or maybe even more likely after the second vaccine. People can develop more flu-like symptoms, sort of tired, achy all over. People can have headaches, a sore arm that is different than just the immunization site. All of those things are possible if by chance people start having a reaction that feels more severe than the symptoms I just outlined, like maybe an allergic reaction, developing a diffused rash or a tongue swelling. Those are almost unheard of, but if those sorts of things happen, that would be the time to contact your physician.
Okay. And if you take medications on a daily basis, we get lots of, calls about this too, because they're on certain medications. Should you keep taking that daily medication after you get the shot?
The answer to that is almost always yes. There may be really rare circumstances where that wouldn't be the case, but by and large, your physician would have talked to you about that already. So continue your medications after the immunization.
Okay, so those are all the timetable, like right after you get the shot in that first 24 hours. Now let's talk about a few days after getting the vaccine. Do we continue to do the 3 Ws after we get that second vaccination?
Yeah, good question. And certainly even if you've had your second vaccine, within the first few days, the data is that you are not as immune to the virus as you will be 2 weeks after you receive the second vaccine. And so no matter when you have the vaccine, in general, the right idea is to continue the 3 Ws.
All right, and the first thing that people are going to ask, all right, I must have immunity because I've had the vaccine. So how long after the shot will you have immunity? And then they're going to ask again, can you stop the 3 Ws then?
So the first question, how long do you have immunity? Truth is, we really don't know right now. So these studies, you remember the time frame, they started in July. We started giving them out to the general public in groups starting in December. And so really haven't had enough experience to figure out the duration of immunity. So we don't know the answer to that. In regards to wearing a mask, there will be a lot of it depends answers here, and folks won't like that. If you're going to the grocery store and you're fully immunized, you should wear a mask, wash your hands, and stay away from people. If you are going to congregate with 2 or 3, 4 or 5 other people who've also had the immunization, your risk of becoming sick or even getting the disease in that scenario is very low.
All right, so then let's cover what people need to know in the weeks and even the months after getting the vaccine. Just how important is it to get that second shot if they've had the first shot?
So with the Pfizer and Moderna immunizations, it's important. And the reason it's important is that the studies were designed in that manner. So people got a first shot, and 3 or 4 weeks later, they got a second immunization, depending on the vaccine that was given. And so for the time being, it's important because that's the data we have, and we can speak with some certainty about what immunity the second shot gives you. There really have not been well-studied protocols using just one immunization for the first dose of the Pfizer or Moderna immunizations.
All right, let's talk about mammograms. Last week, Who Wants to Know talked about it a bit, about why there is a recommendation that you should wait 4 to 6 weeks after your second shot to get your mammogram. Let's talk about why that is.
Yeah, I support that recommendation. And the reason is that when someone gets a vaccine, their body, our bodies are developing an immune response to that vaccine. And it's possible that part of that immune response is developing enlarged lymph nodes, because lymph nodes are part of the immune system. And sometimes those enlarged lymph nodes can be picked up on a mammogram, where a woman could have a false positive mammogram in that scenario. It's not likely to happen, but it is absolutely worth waiting 4 to 6 weeks after your last immunization to get a mammogram.
Mm-hmm. And just how important is it to keep a record of that COVID-19 vaccination? I mean, I know they put it on a card for you, and sometimes we slip things in a pocket or a coat pocket or something like that and we forget about it, but how important is it?
Yeah, all of us, of course, all of us should keep all of our immunization records. And I understand that things get put in a pocket and lost, and it's hard to recreate the immunization. Keep the card, and I have kept my card, and I've taken a picture of it because it's less likely that I'm going to lose my phone than it is that I'm going to lose the immunization card.
I'm right there with you. All right, what should you do, though, if you do lose that COVID-19 vaccine record?
Yeah, there's a record of people who have received their immunizations. And the first place to start would be with the provider that gave you the immunization. So if Cone Health provided your immunizations, contact us. If it was the health department or another provider, start there, and they should be able to recreate the card.
All right, one more question before we head to break and get to the Q&A. Will another shot be needed down the road?
Really good question, and I don't like answering questions with I don't know, but I don't know, and I don't think anybody knows. And the reason is, I'll back up to, look, we just started studying these immunizations in July. We just started giving them out to the general public in December. and we don't know what the full-term immunity is for these vaccines. And so we will learn more over the next several weeks, several months.
Kind of like how we learned so much over the first few months during COVID when all of this started. All right, thank you so much. All right, Dr. Swords is going to be with us until 6 o'clock answering your coronavirus questions. You can text those questions to us at 336-379-5775. We'll be right back.